in 2007, some Canadian doctors actually, found out a patient who has a green blood. Green blood. Let's see together what's the story. Okay, so in 2007, some Canadian doctors at St. Paul's Hospital were doing a surgery on a 42 years old patient. And during the surgery, they were shocked to discover that the blood that is circulating in his arteries is a green blood and not red blood. Of course, they didn't think that he's Hulk, but they were, they needed to take samples of that blood and test it. And then they have continued the surgery, and it went very well and successfully. After the surgery, the results of the blood test arrived, and it turned out that this blood is green because there's a lot of sulfur atoms combined to the hemoglobin that carries the oxygen inside the body. Of course, hemoglobin is the molecule that is responsible for the color of the blood. And naturally, it's right, but because there's sulfur atoms connected to it, it produced a green blood. So now we know why the blood is green, but why we don't know why there's this amount of free sulfur atoms circulating in the patient's body. So they have revised the clinical case of that patient and discovered that he is a migraine patient. And in order to relieve his pain, he was taking sumatriptan in an excessive way. And sumatriptan contains a group called sulfamide. This group, when dissolves inside our bodies, it creates and it produces free sulfur atoms. And then these sulfur atoms combine to the hemoglobin and produce the green color. Now, in order to stop this green color, they have stopped the sumatriptan medicine for 5 weeks. And naturally, as the blood has reproduced itself, it has reformed in a natural way, because the permanent source of the sulfur is now has now stopped. Okay, so I wanted to share this interesting fact with you because it's really interesting and deserves to be shared. And you can, get some useful information from that. For not being so scared if you have seen someone with a green blood, because maybe it's it's something related to drugs that he's taking. So I hope that you have enjoyed this video, and I hope it was useful and helpful for you. Wish you the best in the world, and see you in another video. See ya!